Good evening and welcome to the second episode on the Public Health Link. Today is September 18th, 2022, and I'm your host, Marisa Salisbury. So I received some fantastic feedback from people that they really like the format of this public health webcast, that the format and the information provided allow them to take the information and look at ways they can apply it to their communities. So I'm so excited to bring you tonight's topics. So tonight we're going to talk about the Lancet publishes lessons learned from the COVID response, the new cases of highly pathogenic avian influenza, and September is National Preparedness Month. Are you prepared? And let's not forget about Tech Corner, the Link event, as well as the pH meter. So let's talk community action. So let's talk about tonight's community action agenda on the Public Health Link. So we're going to talk about the Lancet publishing lessons learned from the COVID response thus far. We're going to talk about new cases of highly pathogenic avian influenza, or HPAI, and we're going to talk about September being National Preparedness Month. Are you prepared? So the Lancet published a 57-page document on September 14th, and this was published by the Lancet Commission, detailing how the COVID response has gone so far. So this is looking at all the way from the global scale down to local municipalities. In case you're not familiar with the Lancet, this is a family of various medical journals, and it was started in 1823 by a very well-respected surgeon, Dr. Thomas Wakely. He wanted to have a place where you could debate and talk about medicine. He was a reformist. It was very important to him that the ability to reform was present, that people would be able to contribute. He was also a coroner, and he also was a member of parliament. This part I thought was very interesting, which I did not know. The name Lancet was named after the knife used for lancing abscesses and releasing their foul contents akin to his editorial objectives. So this tongue-in-cheek reason of why it was called the Lancet really brought about, though, a great way, probably a great table discussion of why it's called this, and let's talk about reform. So as a result of COVID, the commission really looked at a thorough response to try to see how are we doing now? Global, national, and local municipalities. So it's been acting like a COVID hot wash. Now, I'm only going to cover one portion, this infographic that was discussed in the paper. Again, it's 47 pages and 57 total, 47 of content, about 10 of resources or references. And I'm going to actually have a special report later this week that dives in this entire report. So I'm only hitting one section of this today. But, it talks about failures of prevention, failures to follow normal public health practices, and failures of international solidarity. I mean, this was a very important paper that it's not, to me, an issue of to agree or disagree. It definitely should be getting some discussion going about what we can do, because it's not a matter of if, it's when for the next major outbreak. So here's the paper, and you'll have the link in your resources. Please take a look at it. I've read it. It was a great paper, but we're focusing on this infographic. Okay, so here I have it enlarged so you can see it. And I'm only going to mention about the two. So at the very top here, these were the major global failures that they found that could be applied also on a local level of COVID. And why are they calling a failure? Because it's believed in this paper that if these aspects would have been addressed, that we would have 17.7 million excess deaths due to COVID. That's a huge number. And they do talk about in the paper where that number came from. So you can look that number up and see that for yourself. So the only two that I'm going to mention on here is failures of prevention and failure to follow normal public health practices. So there were some, and they discuss this, some public health information that changed according to public sentiment. And we definitely seen this, vaccinations, absolutely, but I would say even in bigger than that was masks, was the recommendation of masks. So some communities stepped back from recommending them because the public sentiment wasn't in agreement. And that's not how public health is supposed to function. So public health provides recommendations. The person hearing it and seeing how they can apply it, to their communities, their niches, their workplaces, their homes. It's up to them to whether or not they make that an actionable item, they put it in action, but the recommendation does not change. Like, that part should stay the same. And unfortunately, that changed. That changed depending on the person providing it, that some of those recommendations were walked back because it was perceived that the community was not welcoming that recommendation. And in addition to that, we saw failures of prevention. So this wasn't just in response to preventing COVID or even preventing an airborne disease. It was the failures of prevention with public health in general. Because what we should be looking at as public health, it's not just about putting out the fires. Imagine being in a burning house and being told what to do in that time to prevent a fire. You're in the burning house, right? So we need to always be constantly talking about ways to prevent all the time. Looking at resources, talking about what actionable items that people can do for themselves, again, in their homes, in their work and school, to prevent the transmission of disease. So when they spot these red flags, they can act immediately. So they can take action as soon as possible, so they're empowered. Another part that was discussed, it says, as you can see here, we're hampered by low public trust and an epidemic of misinformation. The misinformation, to me, is pretty self-explanatory. And there were some giving information that were not public health professionals, but were simply giving an opinion. And some perceive that as a public health recommendation. But the low public trust is kind of linked to what I was discussing. Making sure that information that as public health professionals, we should always be in contact with communities, not only when there's a disaster, not only when there's an epidemic or pandemic or outbreak occurring, but it's imperative of those in-between moments. And some of the ways that they discussed, and I only highlighted one here, was how, what can you do to remove these barriers? And they said establish a global pandemic agreement. And I have to tell you, with being in public health, it is very important. We have something called MOUs, and these MOUs at a national, state, and local level are agreements that allow like local municipalities, state officials, federal officials to readily and easily transfer services, personnel, resources back and forth in between in the event of like a mass event like with COVID or even a localized outbreak. Well, it makes sense to have a global version of an MOU. That makes absolute sense, so that we're not then afterwards saying, well, how should we do this? That blueprint's already been laid, so we already know who's going to provide what. It's like having a party and knowing which person is bringing what to the table, right? That allows us to do that. And a necessary investment was to strengthen national health systems and increase investment. Public health is underfunded, and it's not just in the United States. This is a global concern. And they outline all the way up to the UN level, the WHO level, of how money needs to be allocated, all the way down to local municipalities, so that we can make sure that not only developed countries, but those that are low and middle income have access to what they need, to resources, to services, and so on as well. Because as we've seen during COVID, it's incredibly important that it's not any one country has access. We need to make sure that everyone's covered. So I recommend for you to read it for yourself. I'm going to have a special report that covers actually the entire document, but we're talking about this for just tonight. So let's talk about our next item on the action agenda, and that's avian new cases of highly pathogenic, avian influenza. So I talked a little bit about avian influenza with the last episode, with episode 1, just to kind of get your feet wet, that you understood. What is this? Well, highly pathogenic avian influenza, or HPAI, is found, or is, I should say, is like a reservoir within wild bird species, specifically water birds, and we see this with ducks. So the ducks that have this typically do not show any symptoms. Unless they have some sort of immune system issue or they're sick with something else, they typically do not show signs of highly pathogenic avian influenza. However, these reservoir birds can transmit to wherever they migrate to, and this is what we're experiencing. So for an example, if a mouse was to run through an area, and we know how much they poop, right? How much ducks poop. If they run through an area, a mouse runs through an area that has fecal matter that's contaminated with this virus, and they go to a backyard flock. they run through. They can actually transmit it that easily. If you're a duck hunter and you're not cleaning your boots really well after you hunt, and you actually shouldn't be wearing those boots at all near chickens. And if you do, you might be transmitting it to your birds from your boots. So this virus is transmitted via these like fomites or surfaces or objects and through the fur, feet, and feathers of animals. And as you can see, this is on the CDC website. Right now, we have over 44 poultry that have been affected. And what that means is these animals are no longer part of the poultry operation. So we've lost over 44 million poultry. That's ducks and, not ducks, chickens and turkeys. They also show here an account for wild birds, which we, of course, keep track of that because we want to see what other birds can potentially transmit this to our domestic operations and even our backyard birds. And there's been one case. This is of humans. This is not a concern for people. We typically don't see this. It's very rare to see this in the United States with people. This is definitely a much larger concern for food security. And this is one of the reasons why our poultry prices for eggs, turkey, and chicken has gone up in our stores. Inflation obviously has something to do with that, but a large part of it too is the current outbreak that we're having of highly pathogenic avian influenza. So if I go to, this is again the CDC website, if I go to the USDA website, I get to actually see how many birds are affected by my state. So if you hover the mouse, so they're showing at 44.1 million across 39 states. That's 445 commercial flocks. Now they may not sound like a lot, but some commercial flocks have millions of birds in one single flock. So that's where you get the 44 million birds. If you hold your mouse over the different areas of the map, you can see what that count is currently for that state. And if you go down, you can actually see which counties within those states have positive birds. Now, what's really difficult about this, even compared to the last outbreak that we had, which was in 2014 and 15, we have states being affected now that were not affected in the past. So as an example, Pennsylvania, who on their website, and the link is you'll find it in the resources, had said they haven't had any cases at all since the 80s. They now have 4.2 million, more than 4.2 million birds that have been impacted by this disease. So it's definitely affecting many states that we even don't typically see in the past that have been impacted by highly pathogenic avian influenza. And on one last note about the disease, I highly recommend there's a webinar that's on the 22nd. So if you have a few backyard birds, if you have a commercial operation, if you're a 4-H county board member, if you're a community member, if you participate in 4-H, this is an event for you. So on September 22nd at 2:30, doesn't cost anything, the USDA through the Defend the Flock program will walk through and talk about what you can do to keep your birds healthy in your community. I highly recommend for you to take a look, and again, the link will be on the resource page. So on one last note for tonight, we're going to talk about National Preparedness Month. And it's really important that we look at this. This could be a time that we see, okay, is our smoke detector batteries good? What kind of fire extinguishers do you have in your home? Are they the right type of fire extinguisher, and are they expired? Do you have first aid kits in your home, your office, your car? This is the time to go through and make sure that you are prepared in case there's emergency. Because if someone is bleeding, that's not the time to go, oh no, I don't have bandages, right? This is the link, and this is under your resource page. They have fantastic information that helps a community prepare. So they tell you what kind of natural disasters, as an example, may you see in your community. So it helps you plan for what you need to plan for. They give you the stats of what communities commonly see, where to get additional information from, how does it look for this year, what's projected. And again, this link from the U.S. Census is included in our resource page. But what I want to focus on for the rest of this portion of our action agenda is making sure that you have plans for all members of your household and our loved ones. So if you care for an elderly parent or a disabled neighbor, then this is something that you need to think about too. You need to make sure everyone that you love and you care for has a plan. This wonderful website by ready.gov talks about some things you may need to consider that you maybe didn't even think about for other members of your household. So if it's a person with a disability, for example, maybe you need to make sure you plan ahead that the type of transportation they would need, that you know where to call. For instance, maybe it's a transportation vehicle that has wheelchair capacity. They discuss about making sure that you have any kind of batteries, like if it's a wheelchair that needs a battery backup, do you have that ability to provide that? They also cover information about tips for people who are deaf or hard of hearing, tips for individuals with Alzheimer's and related dementia. They do a fantastic job of looking at what you can do for every member of your household. So thank you very much for joining me on this action agenda. Hello and welcome to the Tech Corner of the Public Health Link. So tonight I'm going to discuss with you a piece of equipment that has not been yet approved by the FDA, but is still in the testing and analyzing process. And I just found it incredibly intriguing about the potential where this could go. So as I'm reading this and going through this article with you, think about where you might think this would be handy. So there's a new tool that's being analyzed, and right now they're using a medical unit with the U.S. Army Reserve to select. There was 10 soldiers that were selected to see how well this equipment works. So this sensor that you can see in the photo in front of you allows medical professionals to monitor the physiological status of their soldiers in real time. So it's an effort for the military to create a health readiness and performance system, or HRAPS, so health readiness and performance system, so they can know right away if there's a soldier that's in distress. So there is a U.S. Army Reserve Major with the 338th Medical Brigade. It is Major Krishnaswamy that talks about it in the article of how important this could be. So she explains this could track several things, but we're only looking at some data. So it tracks the soldier's electrocardiogram, and it uses the information through an algorithm. It was developed at the Walter Reed Institute for Research to relay the soldier's body temperature and core temperature. It also relays information about their heart rate, exertion level, and variability in their heart rate. The device pairs with an application that can be downloaded on any cell phone and relays geographical locations for all soldiers wearing the HRAPS. So remember, the HRAPS is the Health Readiness and Performance System. So it's still in development. Like I said, there's 10 soldiers that they're currently testing this on, and it was actually done over a 72 hour period of time with the 901st Minimal Care Detachment out of West Virginia. I have to say, I was just so intrigued by this, because not even just looking at the potential and the wonderful benefit to those that are serving their country, but also I thought of like the high school kids that you hear that during practice where they don't realize they're dehydrated, they don't realize they're overheated, and then they have some sort of medical event that happens on the field. Imagine what this could do. So this could signal, because the part that stood out to me was when it says that tracking the variability in their heart rate. So knowing someone's heart rate at that moment, they could have a perfectly normal, in that moment, heart rate. But when you track and you see trends, or you track and you see sudden spikes or drops, that can be a signal that something isn't right either. So I thought this was incredibly intriguing. You can see how small the actual device is. And on this other link, I actually have a few more pictures to show you. So this is the picture of how small the link is. I think it's great to see this metal next to it, because you get to see that the core of this unit is only a little bit bigger than that metal. So it's not something that, it may feel unusual when they first adhere it to their skin, but it's not something that is going to hamper or affect their ability to perform. And then if I go down further, this is how they're showing that it can be tracked on the app, which I just thought was fantastic. Because, I mean, think about this. It gives you this data, but then it tells you where they're located. So it, as I explained from that major who talked about how it gives a geographical location. So you see if there's a soldier who's in distress, you need to know where they're located. But although, again, the focus and this particular study is being done on a military basis, I could definitely see, other instances that are like sports is what came to my mind with like junior high and high school kids, to see and monitor whether they could be in potential distress. So thank you for joining me in this episode of the Tech Corner. On the second episode of the Public Health Link, tonight's Leak event is a public health speaker series that University of Michigan is facilitating. So this Thursday, that's September 22nd at 6 p.m. Eastern Standard Time, the speaker is going to be Mara Kranis. She's an infection preventionist. So what they explain on their site is that she's an experienced infection prevention and control specialist whose work is focused on patient and healthcare personnel safety, as well as quality improvement. Prior to joining Trinity Health, St. Mary, Mercy, and Livonia, she worked as an infection preventionist at Detroit Receiving and Harper University hospitals. Her responsibilities include conducting surveillance of hospital-acquired infections, developing and implementing infection control guidelines, rounding and monitoring compliance with infection prevention practices, conducting outbreak investigations, and so much more. It sounds very interesting when you talk about somebody that does infection prevention in a hospital. It's very involved. And I'm interested to hear how she controls that in a hospital and what her recommendations are, and how she applies what she's learned so far. And it was kind of interesting. There's a part in here, if you go further down here, this is what I just read to you, this first paragraph. Well, when one of her free time interests, which I thought was kind of interesting, it says in her free time, you can find her listening to her favorite infectious disease podcast. This podcast will kill you. I have to say, I'm going to look that one up. I thought that sounded incredibly interesting. And it's because she put in here about her interests. I would have heard about it except reading it here. So again, this is a public health perspective speaker series. It's facilitated by the University of Michigan. And Mara Kranis is their next speaker. And that's this upcoming Thursday, September 22nd at 6 p.m. It is entirely free. And the link that I'm providing you in the resource portion of this webcast, all you have to do is click on it. It'll take you to this page. You hit join event. And when the event is happening, your Zoom event will actually open up. So I hope you enjoy tonight's Leak event, and I hope to see you there. Welcome to the second edition of the Public Health Meter. So this is a fun kind of segment that I enjoy doing, where I highlight some sort of topic or article or event or something that hopefully encourages you to do something. But I grade it. I'm essentially grading it on what I'm calling the pH meter. In this case, the pH means public health. So the public health meter, public health spectrum. So I'm looking at whether this information or site or source is acidic. So if it's acidic, that means it encourages people to do nothing. Like it doesn't encourage you to go out. You want to sit back and go, I don't want to touch this with a 10-foot pole. Okay. Or whether it's neutral. So neutral means it's not really actionable. It's more so I'm providing information. This is a great place to get information, which is not a bad thing. Could be a jumping off point. So information's not bad. Or is it alkaline? And if it's alkaline, that means it encourages you to do something. So either talk about it with other people, or you look into it for yourself, or how can I reproduce this in my own community? It encourages action of some kind. Obviously the opposite of acidic, where I'm saying it encourages you to do nothing, right? So for tonight's pH meter, there's this great press release that was from Clark County, in Washington State, where it's a septic program that helps people with minor and major repairs for their septic systems. So septic system health is very important. When septic systems don't run properly, it can become a watershed issue. It can add to runoff. So it's definitely important that your septic system is functioning as it should be, but it can be incredibly costly. And when something goes wrong, especially when you're not expecting it, that it can be quite a shock, a sticker shock, when you realize how expensive this is. So this is a program, and they're advertising this during Septic Smart Week. So Septic Smart Week, although it ends today, today's the last day, the program itself is still available, according to this press release. So I thought if you live in Clark County in Washington State, or I would highly recommend, if you don't live in this county, but you didn't know that county government can actually offer grants for septic repair, I highly encourage you to reach out to your county. Because it turns out there are other counties. I know in my county, there are county grants that are available as well in Michigan that can assist. So if you're unsure, reach out to your own county municipality and see what grants are available. But in this case, to go back to this one that's being offered by Clark County, the whole thing, I like the fact that they explain why it's so important to have, a good running septic system. But I like the choice of what they called the program. Because I think it's a great way to encourage people to talk about it, or at least remember it. If you're not comfortable talking about it, you're definitely going to remember the name of it. So if I go down here, and one of the programs is called the Poop Smart Clark. I just thought that was clever. Whatever way we can, keep conversation going about looking for public health programs is fantastic. So this highlight of this particular program is that they will help and assist with minor and major repairs and inspections, and as well as maintenance. So if you're in Clark County in Washington State and you're in need of assistance with your septic system, you can reach out about this Poop Smart Clark. That's the name of the program. And they also have a web link here. So you can actually go right to the web page and they'll can discuss more information about the program and eligibility. But I do want to stress with you, if you are having septic, concerns of your own, and if you don't live in Clark County, that's okay. Call your county government, because it's not uncommon for them to offer some form of septic assistance. What's great about this one is they're taking advantage of Septic Smart Week. They're using this as a platform to try to get as much information out to people as possible, so that people in that county are aware of what's available. So for today's public health meter, public health spectrum, I'm actually giving this a 9. Okay. So why am I giving it a 9? I'm giving it a 9 because it'd be a 10 if more people could access it, to be honest. But the reason why it's a 9 is you might talk about it. I'm hoping that if you hear me speaking of this now and you know someone that's having, some financial restraints and they might be having concerns with their septic, you can now recommend to them to call their own county government. So it's a good conversation. It's something that you can discuss with other people, even if you don't reside in Clark County, Washington State. Thank you for joining me on this edition of the pH meter. On the second episode of the Public Health Link, we covered a heck of a lot of information. Our action agenda, including a paper that was published by the Lancet that was essentially a hot wash or lessons learned from the COVID response so far. We talked about new cases of highly pathogenic avian influenza. And we discussed that September is National Preparedness Month. For our Tech Corner, we discussed technology that's being tested by Army reservists that could help flag a soldier that's potentially having or experiencing physiologic distress. For our PH event, our public health event, we talked about a speaker series with the University of Michigan that talks about infection prevention. And for our pH meter, we talked about how a public health program in Clark County, Washington State, that's helping people with the cost of repairing, maintenance of their septic systems. So hopefully with the information that we discussed this evening, that you'll be able to apply it to your communities and talk about it with your friends, your family, and your loved ones. I look forward to seeing you at the next episode of the Public Health Link on September 25th. And watch for this week's special edition that's going to be discussing that paper more in detail that was released and published by the Lancet. So I have one question before I end tonight's episode. How can you contribute to the health of your community? Have a wonderful week, and I'll see you next weekend.